Chronic infections. Learning outcomes. At the end of the presentation we'll be able to learn following. Osteomyelitis. Diagnosis and management of chronic osteomyelitis. Chronic sinus and fistula. Types of sinus and fistula. Osteomyelitis. Osteomyelitis is a bacterial, or fungal, infection of the bone. Osteo meaning bone, and myelitis meaning inflammation of the fatty tissues within the bone. It can be acute or chronic. Chronic osteomyelitis. Chronic osteomyelitis is a severe, persistent, and sometimes incapacitating infection of bone and bone marrow. It is often a recurring condition because it is difficult to treat definitely. Clinical features of osteomyelitis: pain, swelling, redness, discharge. Diagnosis. Management. The Kearney and Matter classification helps to define features of the infection in the bone, 4 stages, and to relate this to the general condition of the patient, 3 groups. 3 groups. Patients can be divided into 3 physiological host types. Type A, no active concurrent disease. Type B, compromised host. Type C, severe comorbidity preventing surgery. The interaction between the patient's health status and the extent of the bone infection greatly affects the outcome after surgery. 4 stages. Stage 1, medullary, only cancellous bone is involved. Excision of the dead bone carried out by intramedullary rimming or by windowing the cortex. The resulting defect may be filled with antibiotic-loaded cement beads or absorbable pellets. Stage 2, superficial. Only cortical bone is involved and this requires excision. It often follows skin ulceration and there may be large skin defects which require complete excision and local or free muscle flaps. If more than 1/3 of the cortical circumference is excised, splintage is essential, usually with external fixation. Stage 3, localized. There is a limited area of dead cortical bone with medullary infection. Radical excision is required and filling the defect and providing soft tissue cover may be a challenge. Stage 4, diffuse. This involves the entire circumference of the bone and surrounding soft tissue. All infected non-unions are stage 4. Resection must be segmental and stabilization in an external fixator will be required. After surgery, patient should be given antibiotics for 6 to 12 weeks. Sinus. A sinus is a blind-ending tract connecting a cavity lined with granulation tissue, often an abscess cavity, to an epithelial surface. Causes of sinuses. Tuberculosis sinus. Pilonidal sinus. Multiple sinuses in actinomycosis. Periauricular sinus. Fistula. A fistula is an abnormal communication between 2 epithelial-lined surfaces. This communication or tract may be lined by granulation tissue but may become epithelialized in chronic cases. Causes of fistula. Brachial fistula. Tracheoesophageal fistula. Enterocutaneous fistula. Park's classification of fistula in ANO. Clinical features of sinus and fistula. Usually asymptomatic but when infected manifest as recurrent/persistent discharge. Pain. Clinical examination. Inspection. Location. Opening. Number. Palpation. Temperature. Discharge. Induration. Tenderness. Investigation. CBC. Discharge for culture/sensitivity and cytology. X-ray. Ultrasound of abdomen. MRI. Biopsy. CT sinusgram. Fistulogram. Treatment. Basic principles. Antibiotics. Adequate rest. Adequate drainage. Adequate excision. Question 1. A 50-year-old male presented in OPD with pain and swelling on right leg. He is diagnosed case of chronic osteomyelitis. Investigations shows that only cancellous bone is involved. This is which stage of chronic osteomyelitis? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Question 2. A 30-years-old male presented with neck swelling and purulent discharge for 1 month. There are no signs of active inflammation on examination except a blind-ended hole on swelling. Patient also has family history of TB. This condition is known as A. Fistula, B. Sinus, C. Abscess, D. Carbuncle.